I'm from. I recently just graduated the nursing program this December. What really got me into nursing was I particularly was a patient at one point when I was a child, and I used to have a really big fear of hospitals and medical procedures until there was this one nurse who really sat down with me, explained the whole procedure of getting my blood drawn, and she was very warm and compassionate with me. And that's something that really made me feel not so scared. And that is the care that I really intend to replicate in my future nursing practice. I recently just finished my emergency department preceptorship this semester, and I knew that this was my place because each and every day I came in so excited. And at the end of my first day, I literally did not want to leave. I just loved the atmosphere. I loved the rapidly changing scenarios, and I just love exposing myself to all different types of diverse situations. And that is something I found myself really able to do in the emergency department. And I don't know like what else to say because
So you could for each interview, like for sure, right, you would go on Google nursing careers hospital or something and see what they pride themselves on and what their mission statement is and pick like one thing that
Mhm.
doesn't sound like you're rattling off their mission statement, but something where it seems like this is the place that you want to work at and you know a little bit about it and like you're
Mhm.
being intentional of where you're applying or whatever. Another thing you could do is I don't know if you ever did any like direct patient care jobs of like nursing assistant or like phlebotomist or yeah, medical assistant or anything like that that you could talk about?
So that's like another one of my issues is that I don't have like a background in CNA experience. The only thing I did was I was a volunteer for the American Red Cross blood donations. So
Okay.
the blood donor ambassador. So I went to different locations around area and I helped them with their donation process and what donation types best suited for their blood type, like power red, the whole process. And then after I monitored them to make sure they were fine, like with the
Okay.
snap. So
Did
I
you
did
actually draw their blood?
no,
No, okay.
like checking in them and screening them and then assisting with different blood types, paperwork, and then helping them after the donation.
Okay. Monitoring. I like the monitoring part because that sounds nursey. Yeah, you could talk about that. When did you do that before school?
Yeah, I did that before I went into nursing.
Yeah. You could mention it briefly that while you were doing your prerequisites or whatever, you did this volunteer experience just to get more experience hands-on with patients.
Hmm.
Yeah. Overall, it's really good. It hits everything that you need to hit, but it's also kind of different in a way. Like it felt not too coached sounding, which I like. I don't want to like mess it up.
I have one more question. So,
Yeah.
if I'm applying to all these emergency department positions, should I mainly take my experiences from my emergency department preceptorship and use those in my answers because that just makes me sound more like in the unit and like what the unit's about, or should I take it
Yeah.
from all of my experience?
It
Like,
would be best to have the bulk of it be from the ER. That way they can kind of picture you working with their patients.
okay.
Yeah. And they know that you actually know what it's like and you're not just liking the idea of it, you know?
Yeah. Okay.
Yeah.
Sorry, I'm just covering up like what I wrote down because I don't want to like. Okay, so there was a time in my where I had a woman and her daughter come in. It was the mother who was suffering from a and after our initial assessment, everything, she began to get agitated and confused, and she became hyperfixated on her medications, such as her dosages of her medications that she normally takes in the morning. And I knew it was my time to provide not only physical care, but also emotional care to this patient. So my preceptor went outside with the daughter and was gathering more information for her. And I went up to the patient and explained to her that I would help her. I would go to her medical history and pull up those medications. And she felt really grateful that I was listening to her because she told me that she was just feeling really confused and dumb because she can't like remember what's going on. And I assured her that it is not her, it's the diagnosis that's causing her confusion. So I went out to the computer, I looked up those medications, and I came back and told her her exact dosages and when she took them. And after a little while, she struggled to retain this information. So I took it upon myself once again. I knew I had to be creative and think of something else that could help her remember this. So I went to the front desk of or the front nurse's station and I grabbed a piece of paper and I went back to verify her medications and dosages and wrote them down in a large font so she could read it on this white piece of paper. And I brought it back to her and she grabbed that piece of paper and never let it go. She was so thankful and this really helped alleviate her anxiety and her confusion because she constantly had a reminder of what she was hyperfixated on, and she ended up taking this paper all the way to the ICU. And I ended up telling the ICU nurse that was there that this paper is really important to her. Just don't let it leave her side. And this is something that just really helped her anxiety as well as her daughter's anxiety in this situation.
Okay. By helping her emotionally, were you kind of making it more likely that she would stay safe because she wasn't like agitated or like trying to get out of bed to do something without help or whatever?
Well, she was just yelling in the whole unit because she felt like
Um,
no one was listening to her because my preceptor was trying to get information from her daughter and they
mhm.
were like kind of like ignoring her in that situation because she was just yelling about the same thing over and over. So that's why I went and got her medications and told her them because she was like, "Oh, do I take two or one?" And she couldn't remember. So then I told her the medications and then I had to go get the paper and give that to her while we were all sitting in the room. And then while my daughter, like her daughter was talking to my preceptor, she was just holding the paper and like reading that. So then she
Okay.
calmed down and stopped like yelling and she just became like super calm after that.
If you want to download my list of 72 new grad nursing interview questions, that PDF is linked in the description. Don't pay full price for it as a supporter of the channel if you use the discount code YouTube. It's only $3. I made it all cute and aesthetic for you guys. It's 22 pages. The idea is hopefully interview day won't be the first day that you encounter whatever question they ask you. I've included every interview question I've ever heard of that any new grad has ever been asked. Don't pay full price for it. As someone who supports the channel, you get it for only $3. Just use the discount code YouTube.
I had a patient who came in. She was around years old and she had a long history of chronic illnesses. So they didn't really know what was going on, but there was sepsis protocol in place. So I inserted two IVs and I was talking to the patient and assessing the patient while my preceptor was still getting report from fire. And I was talking to this patient. She said that she had really bad back pain. So I assessed her pain levels using PQRSTU. And then went to further my assessment. I noticed that one of her legs was really warm and swollen and hot to the touch. And then I was like, "Oh, are you experiencing any leg pain?" And she was like, "Yeah, actually, I am experiencing some leg pain." And this was like a ding, 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 like this isn't good. Like she might have possibly have a DVT, and if this like led to PE, she would be experiencing back pain. So this wasn't noted in the report that my preceptor did get. So I informed my preceptor of this, and then we both went to the doctor station, and I this was a really busy day on the unit, so it would have taken a while for the doctors to make rounds, especially because the sepsis protocol for this patient, it was just waiting to get all of her labs. So this is something that was very critical because if I waited, it could have caused further exacerbation if it was a DVT or a PE. So I gave the doctor an S bar, let him know what was happening, and I asked him if he wanted to order any tests. Like I'm pretty sure it's an ultrasound that you do to diagnose a DVT or something,
Yeah,
right?
yeah, yeah.
So I asked him if he wanted to do an ultrasound or anything, and the doctor immediately went with me to bedside to assess the patient, and he ended up ordering the ultrasound, and he thanked me for coming straight up to him and not waiting and delaying the care because this could have been a potentially hazardous issue that could have put the patient at harm. So, something I learned from this is to always speak up if I do notice something. And even though I was in a place where I was not a like I don't know if I can say that. I wasn't like a real nurse yet.
Oh,
Um,
you say even though I was only a student nurse at the time.
yeah, even though I only was a student nurse at the time, I always know that's important to speak up when I do notice these things because even if I'm wrong, at least I know that like safety is a priority and that the patient was safe. Like
Yeah.
I don't really
Yeah,
know.
at least you escalated it.
Yeah,
Or at least you brought it to the attention of the doctors so that they could work it up
yeah.
or rule it or so that they could rule it out.
Hmm.
Yeah. Okay, I like it. You don't even need me.
I'm just so nervous. There was a time where I had a patient come into the emergency department and I had to insert IVs on him, except he was very dehydrated and had thick skin. So I thought this was going to be a challenge, but I ended up inserting the IV, except for when I was retracting the needle, the catheter wasn't fully inside. And I kind of started to panic because I was like, uh-oh, like I needed to remove this IV and restart this IV. And the patient was scared of getting poked, so I felt really bad. And then luckily my preceptor was standing right next to me and he was like, you know that you don't have to remove this IV. And I was like, what? And he explained to me that you could use positive or negative pressure to insert the rest of the catheter without retracting the whole catheter. Sorry, I didn't practice this question at all. My preceptor taught me that you could actually attach a flush to the end of the pigtail, and as you are flushing the IV, you could actually also advance the catheter. So this is something that I had no idea you can do. And it really helped just get the catheter right in. And it allowed me to not have to repoke the patient who also did not want to be poked again. And something really cool about this is that a week later, I was standing next to a paramedic student who was also inserting an IV, and the same thing happened to her. And I was able to use what my preceptor taught me, and I showed her how to attach the flush and use the positive pressure to end up inserting the IV also without removing it. So this was a super great learning experience, and it's also something that I was able to share with other people who also needed the additional support.
I would also just say something about how you love when anyone's willing to give you any tips and tricks like that that just
Mhm.
help make your job easier. You always really welcome any feedback that anyone has.
Mhm.
Okay, cool.
And then he
Cool.
also taught me that if that doesn't work, I could also try pulling back and retrieving blood from the catheter as I'm pushing it in, and that also helped,
Oh,
which is
cool.
something new.
I'm gonna try this someday.
Okay, so my first goal would be to gain the opportunity to join this nurse residency program. I see myself constantly learning, expanding my skill set, asking questions, and really getting to know the ins and outs of the unit. After the nurse residency program and during the nurse residency program, I see myself excelling as both a nurse and as a part of the family. I see myself really becoming a seasoned nurse. And once I become confident and solidified in my skills, I would love to become a preceptor. I would love to be that resource to give back to future new graduates and new students because that is something that really helped me grow as a new nurse. And I would also love to become a charge nurse one day to act as a resource to all the other nurses on the unit. Um, and something else I'm really passionate about is quality improvement. And I know that's something that is a part of the mission is to constantly strive for excellence. And by focusing on that, I would love to focus on quality improvement projects on the unit so that we could constantly maximize patient care outcomes and the unit excellence. And something else I would love to do is to continue my education through certifications. I would love to get ultrasound IV certified because that's something that I saw a lot in my emergency department experience. And I would also love to gain certifications to become an advanced trauma care registered nurse one day.
Anyone who doesn't hire you has problems. Um,
The way I just talk is like I just need to like bring
No,
it
you're
together.
good. It's like what I like about it is you're hitting all the points that you know you need to hit, but it doesn't sound like you've said it 100 times already.
I
You know what
haven't.
I mean? Like you're saying it in your own way, kind of, where it feels like you're just hanging out talking to me. Um,
Mhm. There was a time where there was a frequent flyer, and upon his admission, all like the staff were like apprehensive about this patient, and they told me to
Sorry, I
avoid.
wouldn't say frequent flyer. I would say a patient that then the staff was very familiar with because they had had multiple prior admissions.
Okay. So
Okay.
it was a patient who the staff were very familiar with because he's had multiple admissions to the unit. And it was my patient. So upon going into the room, one of the staff members told me in the past he's been very verbally and physically aggressive. And I went to the room and did my initial assessment with my preceptor. And I could tell that the patient was a little angry and he was kind of resistant to talk. And he just began like saying different things that weren't necessarily the nicest things to say. And I knew that anger normally stems from somewhere else. Maybe it's because of a feeling of feeling unheard or just not knowing what's going on in the situation. So I sat down with this patient and I just asked him what was going on and how he was feeling, and if there's anything that I can do to make this a little bit easier for him, because I know that the is a scary place to be and it's not everyone's favorite place to be admitted to, but I really just empathized with this patient, and he told me that everyone just ended up touching him and not really telling him what was going on and doing things to him without asking first, and that's something that made him feel really uncomfortable and frustrated. And I empathize with him because if I was a patient in his position, I probably wouldn't feel comfortable with people just touching me and not telling me what was going on either. That is something that would make me feel really scared. So I told him that in the future, every time I come in, I will make sure that not only I, but everyone else informs him of what's going on and tells him the reasoning of why we're putting on a blood pressure cuff and what it's doing and how it's going to work, because that's something that he should feel comfortable with and be involved in his care with. And after that, he was a great patient. He ended up joking with me during the shift. He became a lot more open and willing to share his emotions about everything. And I don't really.
Yeah, like maybe he shared a little bit about his life. Maybe he shared with you how his journey has been so far in the hospital and, the things that are upsetting to him versus what he prefers, and was able to kind of build that trust and rapport with you where he didn't have to be on guard, always worried that someone was going to do something to him without telling him first.
Yeah, I think it's because of like the past visits he's had kind of impacted this visit. And
Mm,
that's like the feelings he had previously. And I feel
yeah,
like that's something that scared him. So
yeah.
that's why he was acting the way that he did.
I've noticed the ERs, it's weird. For some reason in Australia, their questions tend to focus more on like ER safety. So,
Uh-huh.
for example, they would ask things like, what are the considerations you would take if you had a patient with a violent history coming in, or a patient with suicidal ideation, or a patient with anxiety, or whatever, like, or a patient with a weapon. So they kind of want you to be familiar with the type of body language you need to keep yourself safe, meaning like non-threatening body language and making sure you don't put your back to the patient, or removing sharp objects or things they could hurt them with if they're suicidal, or
Tone.
yeah, doing like proper assessments if they have any mental health challenges to see like what kind of support they need or whatever. So just I don't know if they'll have any focus on that in interview, but you could mention, since ERs tend to like this, that you made sure to, because you had heard that this patient on a previous admission had, that you made sure to never put your back to the patient, to always make sure that you would be able to leave the room quickly if you needed to for your safety. And then you made sure to put a sign on the patient's door, please talk to the nurse before entering the room. And then like phlebotomy too, I think sometimes with those patients, they appreciate someone there just in case the patient like, or you guys don't, do you guys draw your own labs, huh?
Normally, but my like preceptor, he was skilled in ultrasound IVs.
Yeah.
So he was the one who often like if there was someone who was really hard stick, then my preceptor and I would go and I'd watch him do the ultrasound IV. And I
Mm,
thought that was really cool. And that's why I started wanting to get into it because he was like teaching me things like on the monitor as he was doing it
that's so
and just like
cool.
showing me how it really works. And then he's like, yeah, this is something you should get certified in. So I was like, yeah, I will one day.
Yeah. So the safety stuff, and then yeah, just making sure he feels heard, valued, making sure that he doesn't feel like he has to be guarded at all times because people might come up to him when he's asleep and just grab his arm for a blood pressure cuff or stick him
Yeah.
with something. Like that would make someone really on edge.
Hmm.
Okay, so for the above and beyond slash compassionate care slash empathy slash fulfilling moment story, what would be like your sweet story of a moment you really showed up emotionally for a patient?
Um, because like if I didn't get questioned on like how to like critically if I like a critical wait, what was my or thinking creatively, then I could use the patient who I wrote down her medications and brought her to the ICU.
Oh, yeah, that would totally work.
But if I needed another one, I had a patient who came in. We were doing a full sepsis workup on her, and I needed to take a wound culture. So I needed to take the wound culture and then redress her wounds after. And she at first was really frightened and she was kind of withdrawing her legs as I was doing this because she told me that in the past, some people really aren't careful and that these wounds really are hurting her and that she'd really appreciate if I was careful with them. So I explained to her, I was like, of course, I'm going to be careful. I'm going to be as careful as I can. I'm sorry, it might feel a little bit uncomfortable, but I'll do everything in my power to make this go as smoothly and as pain-free as I possibly can. So I removed the dressings and was swabbing the wound, and she was just talking to me the whole time. And she's like, wow, I've really never had anyone as careful as you doing this. And I'm like, really? Thank you. I'm really trying my best to make you feel comfortable. And as I was cleaning the wound, we were just really getting to know each other. And she was asking how long I've been a nurse for. And I was like, no, I'm a student nurse. I'm not a nurse yet. And she was like, well, I know that you're going to make the most amazing nurse. And I was like, thank you so much. And she's told me just like how I was going to end up exactly where I needed to be. And that she has no doubt that I will make the most amazing nurse in the future because I was the best nurse that she's ever had. And I ended up just really bonding with this patient. And she explained to me how she was really scared to be in the hospital. However, I brought this like warmth to her, and she said it wasn't only my care to her based on being careful with her wounds. It was also just the energy I brought into her room. And after I fully redressed her wounds and everything, I asked her if she needed anything else, and I told her that I would be able to turn off the light and close the curtain so that she might be able to get some sleep because she was really tired. And at the end of it, she told me that she felt like she was in a resort, and we both just kind of laughed with each other because I was like, oh, that's not something I normally hear from patients, and that they felt like they were at a resort. And we just had a really great time together. And that's the type of care that I intend to deliver to every patient, just make them feel comfortable and safe and have their emotional needs met as well.
Yeah, I would maybe even lean a little bit more into her being reluctant to even let you unwrap her
Yeah.
feet to do the culture because then it highlights even more the fact that she did trust you.
Hmm.
Lean a little bit more into like what she said because I know she said a lot of things about you, but I'd like to be able to picture you kind of asking her about her life and her journey through her healthcare experience, or I'm sure you guys like talked back and forth, like
Hmm.
whatever she shared.
I had a patient come in and we weren't sure what was really going on, but we called a code stroke and we did a full stroke workup. And then the doctor ordered a Foley catheter. So at the time, the husband was also in the room and he was kind of informing everyone of what was going on, and he was just very confused. So we told him as much as we knew. I sat down with him and explained the whole process on the whole stroke workup, why they were taking her blood sugar, why they were doing different assessments. And then I also told him about a catheter, how that we did a bladder scan. Her bladder scan was so I told her husband, so she's retaining her urine, and that means that her bladder's super full. So this catheter, it's a little tube that goes straight up her urethra and into her bladder, and this is just going to help relieve all of that pressure, and it's going to drain all of her urine out. And he said that, like, he was very thankful for me to take the time to sit down and actually explain to him what was going on, because it was a very stressful situation at first with many people in the room, and me taking the time to explain that to him made his anxiety go down, and he felt very grateful that his wife was in good care. And upon inserting the catheter, I was inserting the catheter into the wife. I noticed that the wife was super scared. She was ANO times two, but she just felt very nervous about what was going on. So I remembered that her husband told me that she loved Elton John. So we played some Elton John. All of us were singing Tiny Dancer in the room, playing the Elton John in her ear during the Foley insertion. And she was also singing along. She remembered the lyrics as we were inserting the Foley. And I don't really know what else to like. That's just like a story about like a patient. That's the last one I remember. It was like with the patient and then also the family member. But I don't know how to like make that sound like or meet what they need to meet.
Was he involved at all in the Foley insertion? Was he like holding her hand or like anything like that?
Yeah,
Or
he was there. Yeah, he was holding her hand. There was
and his job was to kind of like explain to her because he knew kind of how to manage her, is that right? Like she kind of relied on him for that.
Yeah, she was ANO times two. We didn't know why. Like we thought it could be a stroke, but we didn't know. And then he was just kind of there. Like she knew who her husband was, and we think she knew where she was, but I don't think she really understands what was the time or anything like that. She was able to like say a couple words and like blink,
Hmm.
but she definitely recognized her husband. She was like humming. She knew like the song, she knew her husband, and I think that she knew what was going on when we were talking to her. You could just kind of tell like she was nodding.
You could have the focus be a little bit more on the fact that she was confused and she was anxious, and that he realized it would be helpful if he could be there holding her hand and understanding. Well, obviously you will explain to her what's happening, but when she's like forgetful, that she kind of kept turning to him, wanting him to explain. He didn't understand it super well, so you were explaining it well to him, and then
Mhm.
you let him tell you guys what music she liked, and he was able to hold her hand to kind of keep her hand out of the sterile field for the Foley insertion. Or
There was a time in my rotation where I overheard a family member getting frustrated in the hallway. So I went over to him and asked him what was going on. And he informed me that his about 20 minutes ago or 15 minutes ago, and that no one's been there to help her clean up. And he said that he was really frustrated because he was told someone would be right there to help her clean up. And he didn't want his sitting in this for that long. And I empathized with him and said I wouldn't want your sitting like that for that long either. I know it must be very uncomfortable, and I understand that this is a very frustrating situation. And this wasn't my patient, but I knew that I did not have any priority tasks going on at the moment. So I believe that teamwork is also a very important thing because we all act as a team. So I went into this nurse's room and I grabbed one of the CNAs that was out in the hallway to assist me with a bed change. And we ended up changing the patient and making sure that she was all dry and comfortable again. And the patient thanked us for giving her the attention that she needed because she was really uncomfortable, and we apologized that she did have to wait for her care. And at the end of the situation, the family member apologized for getting frustrated because he just felt like his deserved faster care, and I informed him that I would do anything I can in the future to help him. And then I went up to his nurse or her nurse and then just told her about like that I changed her bed and everything. I don't
yeah, I think a phrase that's really helpful for family members is saying, "Thank you for bringing this to my attention,"
yeah.
because it's sort of like, I heard you, I'm on it. Like
Yeah.
you did a good job advocating.
Yeah.
An emphasis on like thanking the family member for bringing this to your attention, that we definitely don't want her sitting in one because it's uncomfortable, but two because it
Like
can,
skin breakdown.
yeah, it can be bad for her skin integrity, and that you will find someone immediately who can help. We're gonna make sure she has completely fresh linens, get her all
Mhm.
clean and dry and comfortable. And then, at the end, like, thank you so much again for letting us know. If there's anything else that either of you need, here's your call button. I'll be around as well. So if you need anything, just let us know. Again, sorry about the wait. I appreciate you advocating for her or whatever, just so that they feel heard, they feel valued, they know they're an important part of the care team. Yeah, that would be really good for like the unhappy family member one.
Is it fine if there was like, so like my example would be like I accidentally sent a lactic acid level without ice.
Yeah.
Okay. So it was one of my first days in the and I was helping triage this patient and draw labs with my preceptor. He was receiving report from fire as I was inserting IVs and drawing labs. So I quickly got my labs and sent them to, because we were doing a sepsis protocol workup. So I sent my labs to the laboratory, and after I sent them, I immediately realized I forgot to put the lactic acid on ice. And this is something that I know can cause false highs on the labs, which may indicate a different medication for the patient or extra medications for the patient that they may not need in the first place. So I immediately went to my preceptor. I told him that I forgot to put the lactic acid on ice and I was going straight to call the laboratory. So I went on the phone, I called the laboratory and told them that I forgot to put the lactic acid on ice. Please do not use this lab and discard it. I'm going to redraw one right now and I'll send it in as fast as possible. And I then went back to the room, informed the patient that I needed to redraw the lactic acid level. And I remembered to bring ice before I even walked in that room. And I sent that lab right after. And I learned from this that it's important to not only speak up if a mistake is made, because that could put either that could be putting the patient at harm or be indicating treatment that the patient may not need in the first place. And as a new grad, I'm going to be constantly learning. And it is possible that mistakes will happen, but it is how you go about those mistakes and how you hold yourself accountable. And for me, integrity is super important to me. I will do the right thing even when no one's watching. I will do the right thing when I do make a mistake and never be afraid to speak up. And I will do the right thing even in the face of adversity. And that is something that I truly learned from this experience. Like something like that.
You can, it felt a little
Like
like
rambling. I don't know what to say.
super impassioned at the end. Yeah, the other thing you could mention too is, it was uncomfortable for the patient to have to be drawn again. And
For what?
what's that? Oh, uncomfortable because the patient had to get poked twice, right? And they
Oh no,
have to hear the,
IV.
what's that? Oh, from his IV.
Yeah.
Oh, okay, okay. That makes it a little bit better. The other thing too is like, let's say it had been a 24-hour urine collection that hadn't been on ice and you had to like start the whole 24 hours again. That would have been like a way worse delay in care. So you like to read your orders really carefully to make sure that you're doing them right, whether it be about a specimen draw or, especially medications or anything like that.
Okay, so what else should I add that like this is super important because if it were something like a 24-hour urine collection or a medication, it's super important to I guess it wasn't on the orders though. It's like you always put it on ice. When we like drew labs, like we don't look at orders. If it's like a septic patient, you do a full rainbow and a lactic.
And you just know that from your policy or your procedure? Or how do you know that?
I think it's on it, but my preceptor just taught me it's like I think it's like the sepsis bundle policy
Oh,
of
okay.
and it's like you start two IVs, you do this, you draw a full rainbow with the lactic. I don't know where it says you have to put it on ice, but I just remember my preceptor
Some people
always said,
that manual.
put it on ice, put it on ice, always put it on ice. If you don't put it on ice, then you're gonna redraw it.
Yeah. You could just say there are labs that have very specific requirements, like putting the on ice, or let's say it had been a blood gas that didn't get to the lab in 15 minutes, or if it was a 24-hour urine collection and I just didn't put it on ice. Both of those things could delay care. And in the case of the urine, it would have been like a 24-hour delay in care, which is harmful for patients. So while it was embarrassing that I had to call the lab and apologize to the patient, and let them know that I had made this mistake, making the mistake early on in my career made me very careful to make sure that I'm being super accurate with specimens that have special requirements.
Yeah.
Okay, cool. The flip side of the, you know how you had that one earlier about whether you can take feedback? They have one that assesses whether you can give feedback without being like judgmental and ruining the relationship. Being able to do it in a way where you're like being supportive of the other person and it builds the relationship because they know they can trust you to like let them know when something needs to be done differently for a patient.
Is that like on like the rubric part of this one? Like what's
So
on
the
like
rubric, so every question that they ask you would have like their own kind of rubric. So the rubric for this would be your ability to speak up about a situation in a way that is respectful to the other person while still like giving them that constructive criticism.
yeah, in my it's not like normal to insert that many Foleys, but for some reason I was inserting a Foley every day. So there was a paramedic student with like he was under a medic and then I was with my preceptor and we were all walking around together and one of my patients needed a Foley. And my precept like I know it's within the paramedic student's scope of practice and I was asking him, "Oh, have you ever inserted a Foley before?" And he said no. And I told my preceptor, "Oh, we should let him do it and we could go watch him." And then my preceptor's like, "Yeah, how about you teach him?" And at first I was like, "Oh, I'm a student teaching another student, but I know what I'm doing. I feel confident in my ability to teach him how to do this well." So I first brought him to a different room and I went over sterile gloving with him again to refresh his mind. And then we also brought a Foley kit and we told him exactly what he would do with that Foley kit. And we ran through it one time before he went into the room just to make sure that he was comfortable. And in the room, I brought an extra pair of sterile gloves so I could jump in and help him if he needed my help. And we brought two extra pairs of sterile gloves. And the first time he opened, well, how do I say this? So he was opening the kit and he was putting on his sterile gloves. However, when he was putting on his sterile gloves, he accidentally touched his like forearm and without causing a scene or without making him embarrassed, I said, "Okay, I have another Foley set here, another pair of sterile gloves. You accidentally touched your forearm and that makes it not sterile anymore. So let's just retry it again. You got it next time." And I made sure to encourage him rather than make him feel embarrassed about this. And he opened the kit next time, put on his sterile gloves, and I also put on my sterile gloves just in case he needed my help, and I was directing him through the whole process, and he ended up not even needing me. And this was a really cool learning experience for not only me, but also for him because I had the experience of teaching someone something in a place where I didn't have authority at the time, or like didn't like wasn't student nurse. I don't know how to say it.
Yeah,
Like I had
where I was a student.
to teach him when I was a student. He was also a student. And at the end, he thanked me so much for teaching him because he said it was super cool that he got to learn how to do that because that's not something that he normally gets to do every day, but it is within his scope. And I don't know how to say, like, I don't know what else.
Oh,
Like,
it would be about your ability to give feedback. So you could just say it just taught me that there's always a good way to, or maybe in times when you need to speak up in order to protect a patient, there's always a way to do it without making the other person feel judged or bad about themselves. That there's always a way to do it where you are being supportive and you're actually building your relationship with that other person, even while you're giving them this constructive criticism.
so what else should I say? Like,
Oh,
I,
just that it taught you that like you totally can do that. And it was like not only a good learning experience for like solidifying your knowledge for that skill, but then also it was a good experience of how to give feedback in a way that is supportive and doesn't leave someone feel like judged or like they're not a good provider or whatever.
okay.
Yeah.
I had a patient come in and this was and he was diagnosed with and he was A&O times two, but during one of my check-ins, I noticed that he was harder to arouse and did seem more drowsy. So I asked my preceptor if it was okay if I could get a blood glucose really fast, just to make sure that everything was okay. So I took his blood glucose and it was a little low. It was at the time. I went to my preceptor. My preceptor told me just to go to alert the attending to have him know and see if there's anything that he would like to give to the patient because this patient was or he was at possible risk of aspiration. So we weren't sure if we wanted to try something like that. So we walked up to the attending and the attending said, okay, I'll put in an order for you. So we walk back and we were checking the orders because I like, is it bad if he didn't tell us what the order was? He was like, okay, I'll put in an order for you. So then we walk back to the computer and we noticed that he put in an order for a full amp of D50. And upon viewing that order, me and my preceptor both didn't feel comfortable with giving that high of a fix to his blood glucose. And we initially went to the charge nurse and spoke to the charge nurse as she's a resource. And she also did not feel comfortable with us giving that um, high of a sugar dose to that patient at the time. So my preceptor then told me to go talk to the doctor and give him an S bar and tell him that I did not feel comfortable with giving this medication. And at first, I was a little bit scared to bring this up to the doctor because I was a student. However, I knew that I would do anything in my power to make sure that my patient's safe, and I would always speak up if I did not feel comfortable with doing something. So I walked up to the attending and I gave him a quick S bar again. I reminded him that his patient's blood glucose was, and I told him that I didn't feel comfortable with giving a full amp of D50 because I believe that this may cause his blood sugar to spike a little bit too much. And the attending thanked me for bringing this up to him. And he also agreed that this wasn't the best possible solution to this patient's blood sugar. And we just ended up collaborating. And I forgot what we ended up giving. I think we ended up giving him like
Half an amp?
D5. I don't know, like something like very like a lot
D5
lower.
you usually do as like a drip. D50, typically
Yeah,
they only order half an amp at a time.
yeah, but he said give a full amp, so we just didn't feel
But like
comfortable
he
giving.
could put the order for half an amp. Like he could change the order amount.
So maybe he did that. I don't.
Yeah, unless you like had to go grab and prime a bag of fluids as like a drip through the pump, he
Yeah.
probably like made it half an amp instead. And then like was gonna have you circle back and tell him what the blood sugar was after that.
Yeah. So should I use that
Yeah.
as something up? Because like
Yeah.
it was like uncomfortable at first because is it like a good thing to say that like my preceptor and I talked about it and then we went to the charge nurse before to
Yeah.
clarify?
I mean, I think as a student that's appropriate. Yeah,
Okay.
like as an experienced nurse, you might say, would it be possible, or do you think it might help to start with half an amp and then I can let you know what their blood sugar is, and they might say, oh yeah, it's totally fine. Or if they feel like they really feel strongly it needs to be a whole amp, then they might say, no, do the whole amp. He needs it. What do you have for like the strengths are easy, but what do you have for the weakness?
I'm just gonna say that my weakness is that I'm a self-critic. I put 110% to everything that I do, and every time that I didn't meet my personal standards, I tend to get a little bit hard on myself. So instead of getting too hard on myself at the end of every clinical day, I wrote three things down that I wanted to work on that day, and I also wrote three things down that I'm really proud of myself doing that day. And that really helped keep up my motivation. And then the next shift, I took out those three things and those three things were those targets that I would really focus and grow upon and learn that day. So at the end of each day, almost every single time I completed those three things. And if I didn't, then I would add that to my next day list. And that's just something that really helped keep me in check. It kept me motivated by showing me how much I truly was learning each and every day. And it also helped target the areas that I did need to work on so I can solidify my skills in those specific areas.
Things for the ER that they could ask would be, I mean, honestly, they can ask. I mean, sometimes they get really specific where they'll be like, you have a patient who is taking Lasix and has heart failure. What are you monitoring for? And you're just like, well, that's specific. I mean, like potassium, fluid volume status, we're probably doing like a daily weight, we're measuring I's and O's accurately, like that kind of stuff, right? Or they could say, they could be really vague and be like, what would you do if you had a patient who was deteriorating? And you're like,
I
do they
feel
have
like
a pulse? Like, what do you mean? Can they talk to me? Are they still like Roswell? What's going on? Um,
Mhm.
and with that, you kind of like just choose your own adventure and say kind of broadly and then to more narrow what you would do. And then ERs focus a lot on strokes, seizures, some sort of respiratory, like shortness of breath or desat or whatever, blood pressure issues, blood sugar issues, like too high or too low. They could also ask you about like heart rhythm stuff. Which of those, or sepsis? Are there any of those things that you were like, I wouldn't know what to do with that?
Um, sepsis, no. Strokes, easy. I feel like the clinical scenario based are the easiest questions for me. For like a heart rhythm, maybe. Like
Yeah,
what heart rhythm would they say? Like, oh, they're having like a STEMI, and then is that something that they'd say?
maybe. Yeah, I feel like STEMI's probably maybe more likely than like if they were Brady or an SBT or had VTAC or something.
I mean,
Um,
what if they have VTAC, like call a code and get ready to shock them? Like,
Well, yeah, so there's difference between like the VTAC and the VFib. Like sometimes you get a call that's like your patient just had 8-second run of VTAC. Go in there and look at them and talk to them, and they're perfectly fine. Just take a blood pressure, get their heart rate, look at their rhythm, and tell the doctor. And like sometimes they'll order electrolytes or whatever. But like it is totally possible that they have VTAC and it's pulseless VTAC, and you come in the room to check on them, and they're not like awake and talking, eating their lunch. They're like they look like they're asleep, and you got to check them for a pulse and get a blood pressure and like it could escalate from there. But for VFib, if the ventricles are just like quivering and not actually like pumping through, there wouldn't be a pulse. So you'd follow your VFib um, flow on your ACLS. But first, are you comfortable with your typical stuff you guys do if someone just comes in with chest pain?
chest pain, you'd probably check their vitals, and then you as you're checking their vitals, you would probably start doing a 12 lead, and then you would during the 12 lead you'd ask them about the pain, how long it's lasting, if it's radiating anywhere, and then you make sure that the patient's able to breathe and their vitals are okay. And once you get that, then if it's bad, then you could call like rapid response if it's getting really bad, and then you could call like a code if they were like having a heart attack. But probably you just take the results to the provider, take the 12 lead results and give him full S bar of what's happening and see if he wants to order like some nitro or something for it.
Yeah, so with the EKG, I mean, ideally you would compare it to a past EKG to see if there's any changes. And then you're looking specifically at the ST segment, see if there's any ST segment changes, like, a STEMI would be elevated. Sometimes there's depression. I think that's for like ischemia.
Draw
And
like
then, what's that?
draw some like trope labs or anything like
Yeah, yeah, they usually want a trope. Like when they come up from the ED, they'll usually say like tropes peaked at whatever, they're downtrending, they had chest pain.
yeah.
Yeah. And then of course you're checking blood pressure like before and after the nitro. And you can also ask them like, has this happened before? Because they might say like, yeah, this happens every time I eat a bunch of hot dogs and chocolate and beer and then I lay down flat. And you'd be like, could this be GERD?
Yeah.
So yeah, anyways, what about um let's see. What's probably the most likely?
I'm guessing seizure or stroke. I feel
Yeah,
like it's always like, oh, you see someone seizing, what do you do? Maybe like you give the patient the wrong medication or something. I don't know.
You said stroke's pretty easy. You feel okay with sepsis?
Yeah, I feel like sepsis, like you just like check all the vitals, make sure that you're drawing labs so you could administer an antibiotic, fluid boluses, loop in the team, the charge nurse, rapid, continually monitor the vitals. You talk to the provider and see if you want to draw any extra labs or blood cultures or anything, and then
Yeah.
just monitor the patient, monitor their temperature, monitor everything. Like I
Yeah,
feel like
so like the order kind of matters in that you would want to do like pan culture them, grab all the dirty stuff you can, and then hit them with the fluid bolus and then the antibiotics after that so that you actually have something that's like circulate it. Um, the main thing is just like not giving antibiotics before you draw the cultures because then your cultures are no good. And then obviously making sure that their blood pressure is stabilized,
yeah,
taking care of any fever.
like, monitor like ANOs, like
Yeah, and then like a VBG with lactate can be helpful. Sometimes even with the cultures, they'll want like a chest X-ray too. Yeah, I feel like you do pretty well with these ones.
Mhm.
So questions at the end too. So you can ask them, there's the typical things of like, what do you love about working here? What disease processes do you typically see in your patient population here on the unit? Yeah, what's your favorite part about working here? What would be the best way for me to prepare in the meantime if I were to get the job?
probably
What
has.
was
Wait,
that?
what? I have one question about this.
Yeah.
What what about like asking, so in your specific new grad program, what is one of your, or I need to like word this right, but like what's something specific to your program that helps new grads succeed when they're coming off of orientation? Like something like that. Would that
Yeah.
be a good question?
Yeah, it's different. I like that. Another one too is what challenges have you seen new grads struggle with and what has been helpful for them?
I like that.
And then anything that they say, sponge it up and make that like the bulk of your thank you letter.
Hmm.
So like, thanks so much for sharing about this thing. I loved hearing about this goal that you guys are working towards. Like I'd love to learn from you together how to achieve that together. Or thanks so much for sharing this thing about the program. It sounds like such an incredibly supportive learning environment. Or like, thanks for sharing about this certain thing that you love about working at. I'd love to be trained at a facility that is committed to those values because I think it's so important for patient care or whatever. Like basically most of what you're talking about is like things that they shared and why that's important to you, why you
Uh-huh.
loved it so much.
Okay. And should
Yeah.
I know them or should I just say this all at the end?
Oh no, no, no. Draft it up, send it to me. I can help you with it. I can't like make stuff up for you, but I can kind of help you like mess
Yeah.
around with what you have. So more is better if you want to do that. And then you can send it to them if you have their email addresses, or you can just send it to whoever was like setting it up and say, I'd love to extend my gratitude to the nurses who met with me regarding this position. And then they might say, like, I can't give you their emails, but I can forward this attachment along for you if you want. Yeah.
Yeah, that'd be great.
Yeah. Okay. Like I said, anyone who doesn't hire you has problems. I would hire you like in a heartbeat.
Really? Thank you.
Yeah.
Thanks.
Don't over rehearse, smile, just get comfortable and have fun with it. You're like more than prepared.
Okay. I don't feel that way. I feel like I need to like think of my stories and just be able to like say them in a better way, but
No, you're doing
otherwise,
great.
thank you.
Yeah, I'll send you this recording. It'll probably take like, I don't know, 30 minutes or so for me to send it, but you'll have this to practice with and let me know how they go, okay?
Okay, well, thank you so much for your help.